Ever wondered about the importance of testosterone treatment? As an essential hormone, testosterone plays a crucial role in various aspects of health, including bone density, muscle mass, and sexual function. But did you know that testosterone treatment requires careful monitoring? Today, we'll delve into the 3 primary parameters for monitoring testosterone treatment. Firstly, the testosterone level itself. Aiming for a level over 900 for most of the dosing cycle is often the goal. This is because maintaining an optimal testosterone level can help improve various aspects of health, such as energy levels, mood, and physical performance. However, it is crucial to remember that testosterone levels should be monitored regularly to ensure they stay within a safe range. Too much testosterone can lead to side effects such as aggression, mood swings, and even physical changes like acne. The second parameter to monitor is the hemoglobin level. Hemoglobin is a protein in your red blood cells that carries oxygen to your body's organs and tissues. When testosterone treatment is administered, it can cause the hemoglobin level to rise. This increase could potentially raise blood pressure and cardiovascular risk, making it an important factor to keep an eye on during treatment. Regular blood tests can help monitor hemoglobin levels and ensure they remain within a safe range. Finally, estrogen levels. While often associated with women, men also produce estrogen, although in much smaller amounts. When testosterone levels increase, so can estrogen levels. This can lead to symptoms such as breast changes or emotional behavior. More importantly, elevated estrogen levels can raise the risk of prostate issues, including benign enlargement of the prostate and prostate cancer. It can also increase cardiovascular risks. Therefore, it's crucial to monitor estrogen levels while undergoing testosterone treatment. In summary, testosterone treatment can bring about significant improvements in health and well-being, but it must be monitored carefully. The 3 key parameters to watch are the testosterone level itself, aiming for a level over 900 for most of the dosing cycle, the hemoglobin level, which if elevated can raise blood pressure and cardiovascular risk, and estrogen levels, which if they rise can lead to prostate issues and increased cardiovascular risk. Remember, while testosterone treatment can be beneficial, it's vital to undergo regular checkups and tests to ensure the treatment remains safe and effective. Dr. Adamczyk is expert in testosterone treatment. Contact the Florida Anti-Aging Center for more information.